Hey class, super exciting. Welcome to your very last lecture video for this class. All right, so woohoo, celebrate that you've made it to the end. Okay, so we are going to talk about diseases of the urinary and reproductive system. So an inflammation of the urinary bladder is known as cystitis. This can be commonly caused by E. coli or Staphylococcus saprophyticus. So bacteria that live in the intestinal area are able to make that short little trip to the bladder. So these are more common in women than in men because there is a shorter urethra and it's closer to the anal opening. Leptospirosis is caused by leptospira interrogans. This can lead to headaches, muscle aches, and fever. Then, when we're talking about our reproductive systems, so the traditional term has been STDs, sexually transmitted diseases. But that word disease implies that there are signs and symptoms, and a lot of times there may not be a sign or a symptom. So now the preferred term is STI, or sexually transmitted infections, because you can be infected with something without having any signs or symptoms. And it's important to know if you are infected with something, because you can still transmit it. There are about 20 million new cases of STIs in the United States annually. More than half of those occur in individuals that are younger than 24. There's a good chance a lot of you fall into that age range. Usually about half of you will be younger than 24. And these can be mostly prevented with condoms. So it is as simple as safe sex practices to be able to enjoy a sex life without the risk of most of these infections. So a big deal, practice safe sex, use condoms. You can usually get condoms from public health associations if you need help securing something. Okay, so let's talk about gonorrhea first. Gonorrhea. Infections with gonorrhea are sometimes called gonococcal infections. So Neisseria gonorrhea is a gonococcal cell. These gonococcal cells can attach to the epithelial wall. It can infect the urethra and the cervix, which are parts of the reproductive system. It can also infect the eyes. So a baby who is born can be infected if their mother has an active infection. It can also infect the rectum and oral pharyngeal cells. So it can also be transmitted through oral sex and through anal sex. If it's untreated, it can also progress to infect more cells. It can lead to endocarditis, which is an infection in the heart, meningitis, which is an infection of the meninges, and arthritis, which is an infection of the joints. Opthalmia neonatorum is when the mother has gonorrhea and it is passed to the offspring and infects their eyes as the baby is being passed through the birth canal. Next is pelvic inflammatory disease. These are extensive bacterial infections of female pelvic organs that can cause chronic abdominal pain. It can also cause scarring that leads to infertility, which is important to a lot of women to be able to have children. So that may be something that you'll need to discuss with your patient. It can also lead to an ectopic pregnancy. That is a pregnancy outside of the uterus, which is fatal to both the developing fetus and to the mother. So that is definitely something that needs to be addressed immediately. Pelvic inflammatory disease can be caused by multiple different bacteria, although usually it'll be Neisseria gonorrhea or chlamydia trachomatis. Chlamydia caused by chlamydia trachomatis. We talked about this having a unique reproductive cycle, elementary bodies and reticulate bodies. If you don't remember that, that's in the end of chapter 11. Make sure you're comfortable with that. Chlamydia is often called non-gonococcal urethritis because it is not gonorrhea, but it can infect the urethra and is associated with an increased risk of cervical cancer in women. Then syphilis caused by Treponema pallidum. We already discussed this one, how it can progress from cankers to a skin rash to these debilitating gummas. Genital herpes, we discussed herpes simplex virus type 2 when we talked about our skin infections. It creates lesions with a burning sensation and it will lay latent, so there will be recurrences of it. Genital warts caused by papillomavirus. We also talked about papillomavirus when we talked about skin infections. And then HIV and AIDS. So HIV, human immunodeficiency virus, is the virus. AIDS is acquired immune deficiency syndrome. So that is the disease. HIV is a virus in the lentivirus family. This can infect the immune cells. It will destroy CD4 helper T cells. So without functional CD4 helper T cells, you are not going to get activated B cells. You'll have a very suppressed immune system, which then allows more rare diseases to show up. So a lot of ways that HIV patients, before we were able to test for the infection, a lot of the ways that people knew they had AIDS was because they started seeing very rare diseases, rare cancer and rare fungal infections. But it also allows viral, bacterial, and protozoan diseases to start popping up and causing infections when they normally would be suppressed by the immune system. Okay, so here is where AIDS, as of 2021, where we had most cases, about 1.5 million cases. You can see 63,000 of those are in North America and Western Europe, although it is a worldwide disease. It has traditionally, or in the early days, it was associated with sex workers, people who inject drugs, and men who have sex with men. So that certainly still makes up a lot of the people who are infected with HIV. However, their partners, you can see 25% of them are the partners of these people. And then 30% is the rest of the population. So people who do not fall into any of these populations still are at risk of having HIV or AIDS. If someone is sexually active, this is something they need to be screening themselves for. Oh, something else about AIDS. So HIV is able to be controlled with a lot of diseases now. So someone who has been infected with HIV, it is not an immediate death sentence that it once was. So this is something to counsel with your patients about what is the best way to move forward when they get a positive test. Okay, then some other microbes. There are protozoan infections of the reproductive systems, such as trichomoniasis, caused by the protozoan Trichomonas vaginalis. This is a normal inhabitant of the vagina and urethra, but can grow and increase when the normal vaginal acidity is disturbed. And then fungal candidiasis. We talked about yeast infections already, caused by Candida albicans, an opportunistic pathogen that usually grows in response to antibiotic use, which can suppress the amount of lactobacillus in the vaginal tract. It also seems to be opportunistic in response to diabetes and hormones, and will lead to a yeasty, thick yellow discharge. Okay, so that's a whole lot of diseases we just went through. So make sure you're comfortable with what disease is caused by which pathogen, what type of pathogen, and signs and symptoms associated with it. Let me know if you have any questions. You still do need to complete your disease report. You will not have a fourth exam. You have that disease report, and then you'll have your final exam. And that final exam, about half of the material on that final exam will come from chapters 11, 12, 13, 18, and this 21 through 26 packet. Okay, I'll see you later. Let me know if you have any questions. It is that time to get in your very last questions before the final exam. So please do come see me or send me an email, and I'll talk to you later. Bye.